Hi, welcome to the Institute of Health and Community Medicine. My name is Professor Dr. David Pereira. I'm the director of this institute. This institute was founded in 1996, and since its founding there has been two directors for the institute. The founding director was Professor Dr. Cardosa, and I took over from her and have been the director since 2010 to the present. Now, the institute primarily focuses on tropical infectious diseases and emerging infectious diseases. So basically what we do is we look at innovation, technologies, fundamental pathology of these viruses that are important for causing diseases not only in Borneo but also in the Southeast Asia region and other parts of the world. So for rabies, we have been funded by the Sarawak state government to come up with a diagnostic tool for quickly diagnosing rabies not only from animals, dogs and cats, but also from humans. And to that respect, we are coming up with a real-time RT-PCR assay to do this. We are also collaborating very closely with Sarawak Veterinary Department and Sarawak Public Health to get both human and animal samples as part of this research. We are confident that we will have a test within the next year or so. Researching a bit on dengue. This has been one of the backbones of the research focus of the Institute, and to date we have discovered quite a few different dengue circulating strains. These include from sylvatic or primate origins. We have also recently discovered a very distant dengue 1 that was first published by Australian researchers who found it in Brunei. We have now found the same. We also are part of an Asia-Pacific network for surveillance on hand, foot and mouth disease that are caused by a number of different enteroviruses. This surveillance network is headed and administered from the National Institute of Health in Taipei, Taiwan. And the Institute is proud to acknowledge that to date we have managed to discover 4 of the 9 subgenotypes of enteroviruses that are known today.
Chinese health authorities are still working to identify the virus behind a pneumonia outbreak in the central city of Wuhan.
Tonight, U.S. airports on high alert, screening passengers for symptoms.
Malaysia's daily COVID-19 cases have also hit an all-time high. More than 17,400 infections have been recorded, just days before the country's state of emergency is due to expire.
The Institute has been appointed as an official certified COVID-19 testing lab, and the federal government has funded us close to the tune of R1 million this year to do the testing for the state. Our current research interest continues to be with the different viruses that I've mentioned to you. And we are also looking at trying to understand the COVID-19 virus a little bit better. We have an ongoing project to determine the prevalence of the disease in our local population. This is important to figure out how many in terms of percentage of our population has been affected by this virus, because that will have an implication on the vaccination program. This will also give us an idea about the vulnerability of our population in terms of its exposure to a second or third wave of the virus. We strive to always do the work that has international and global appeal that meets the standards of peer-reviewed international journals. And in that respect, we are very proud to say that all our publications thus far has been in high-impact international publications. And this is the goal and the standard that we set for ourselves. And this is the culture that we have managed to inculcate in both our staff and our students, whereby all of us feel that we are part of a larger family here and are excited and motivated to do the work that we are doing. So I think in that respect, that has been our greatest achievement in the management of human resource, to instill that sense of motivation for research that brings out the best in terms of creativity and innovation from our young minds of our students, and also to spur our staff to move on to greater heights.